Okay, well, Dr. Amar Mashru is from one of the group of doctors who are taking legal action against Jeremy Hunt's plans to impose the new contract. He joins me now from our studios in Bangor. Hello to you. Thanks very much indeed for being with us. You may have just heard that clip of Jeremy Hunt where he said that he reckons the strike action that's been called will lead to 100,000 operations being cancelled, 1 million hospital appointments being postponed. The polls suggest that the public still support the junior doctors in this dispute, but that's going to erode, isn't it, the longer strike action continues?
Yeah, I mean, look, I think it's really interesting that Mr. Hunt wants to throw statistics out about the damage that's going to be caused from this strike action. Let's look at how many hospitals have had to close down their services just in these last few months alone. A&E's closing down, a complete restriction of patient access to urgent care because of the cuts imposed by Mr. Hunt on our health service at the moment. Now, he claims that whilst all of these cuts are going on, whilst the NHS is struggling to meet the basic requirements that patients need day to day, he's going to expand services provided without providing any extra funding or any extra staffing. This is complete nonsense. Whilst you point out, public support is with us at the moment, actually I think the public are more aware than ever that they are being lied to by this health secretary and by the Prime Minister that support him, that he has any interest in working towards improving patient care and patient safety in this country.
But your own union backed this deal only in May.
That's not true, Clive. That was the president of the JDC, who led the negotiations, said that he felt at that stage, within the limits he was given, he had achieved the best job he could achieve. I think that's a very fair statement for him to make. He should have been proud of what he'd achieved. But let's be honest, the arena in which he was allowed to negotiate was completely flawed from the outset. The fact that this government are trying to set this junior doctor contract in the context of delivering a 7-day service, when they have absolutely no evidence that this contract is going to do anything to improve patient services, when they have made no effort whatsoever to provide the extra funding and the extra staffing required for this contract to be implemented safely, unfortunately, it was never going to be anything but a disaster, and it was never, ever going to improve patient care.
The British Medical Association says that the 5 days of strikes that have been announced from the 12th to the 16th of September will include the full withdrawal of labour during that time. So no emergency cover?
To be honest with you, Clive, I do need to wait the details of exactly what the strike is going to include. As you know yourself, this announcement has just been within the last hour, and much of that time was me getting to the studio to make sure that I could be here to talk through the announcement with you.
Sure. Okay, I fully understand that. What about the court case that you are part of in trying to overturn the imposition of this contract? When might there be a resolution to that?
I think you would have probably known, Clive, we've had leaks from the Department of Health only last week revealing and confirming junior doctors' worst fears, that the very civil servants that are designing these policies, including the junior doctor contract, have extremely real fears that they are never going to be possible without funding. There is no evidence for them, and they don't have the staffing required for them to be delivered. Our court case is challenging the lawfulness of Mr. Hunt's imposition of this contract on junior doctors, that unilateral imposition against their will and against the advice of senior clinicians and medical advisors to the Department of Health. It is also questioning the rationality of Mr. Hunt's decision-making. How on earth can he be claiming that this is in patients' interests when he has no support from the very people that are advising him on how to improve patient care? We hope that our case will be heard on the 19th and 20th in the High Court of September, in the High Courts in London. And we hope to have an announcement within 10 days after that.
Okay. Well, thanks for that detail. Dr. Amar Mashru there in Bangor, and by the looks of it, still on shift. Thanks for giving us the time to give us your thoughts. Thank you.
Thank you.